Trying to contain an outbreak is difficult, particularly in the early stages. But making things more complicated, certain people are predisposed, without knowing it, to make things worse very quickly. Meg Tirrell is back with a look at super spreaders. Who are they?
Well, on average, Contessa, one person with this novel coronavirus is thought to infect maybe 2 or 3 other people. But some are tied to much larger numbers of cases, and they're called super spreaders. They can play a big role in outbreaks.
On the Diamond Princess cruise ship, now in quarantine in Yokohama, Japan, there are more than 200 confirmed cases of the novel coronavirus. While experts don't yet know how each person caught the virus, they say the cases may be traced back to one passenger.
This one individual from Hong Kong looks like they infected 60 additional other people.
And elsewhere, reports of a British businessman linked to 11 cases across 3 countries. These so-called super-spreading events are nothing new in infectious disease. They were identified in outbreaks of SARS, Ebola, and MERS.
There are events where one person, instead of infecting the typical 2 additional people, which is what we usually see in this disease, this new coronavirus causing SARS, sometimes that individual can infect 10, 15, 20, 30 more.
And they can drive the spread of outbreaks across the globe.
SARS, health officials became aware of it only a month ago, but it's already a major concern around the world.
In the 2003 SARS outbreak, a dozen cases were tied to a visitor to the Metropole Hotel in Hong Kong, a Chinese doctor who'd treated undiagnosed patients with the virus. Some of those 12 then traveled to Singapore, Vietnam, Ireland, Canada, and the United States, infecting directly or indirectly more than 350 people.
And we're going to bring in back Dr. Scott Gottlieb now. Dr. Gottlieb, what makes somebody a super spreader?
Well, sometimes it could be a function of someone who sheds more virus, but oftentimes it's a function of what you're doing. So if you have the virus and you're handling food, for example, you can spread it to a lot of people. In the case that was talked about in your segment, the person was a physician treating a lot of patients, touching them, spreading it that way.
So we also know that one of the super spreaders who's been identified, the gentleman from the UK, had been in Singapore. Then he went to a French chalet and spread it to 11 more people. We want to talk about Singapore because you're watching that very closely. What do you see there that is concerning to you?
Well, first of all, they have some community transmission. We don't know how pervasive it is. Singapore is still a conduit of travel through China, and as well as directly from Singapore. And Singapore has such good controls in place and such a good public health system. They were hit very hard by SARS, so they put in place very good systems for trying to contain outbreaks, that if Singapore isn't able to do it, I think it diminishes the chances that other nations are going to be able to contain this if they start to have community spread.
We saw that case accounting that Singapore does. Do you think the U.S. should do that, and can we do that?
Well, I think if there's outbreaks here, we'll try to do that. We're certainly going to do contact tracing like Singapore does. I'm not sure that we're going to be able to get to the same granularity that they're able to get to because they have such an exquisite system, and we have a much larger and more diverse country. There's certain cities that have very good systems in place, like New York City. I think you'd see a very robust response from New York City. Other localities are probably weaker.
You said that there's a community spread there. 58 people now have confirmed cases. Are you concerned that people from Singapore are still free to travel to places that have restrictions in place against those who've been to China recently?
That's right, and people can come through Singapore. Up until recently, they've now put in place travel restrictions. The problem is we don't know how pervasive the community spread is. Of the 58 cases, I think about 8, they haven't been able to trace it back to a source, and so that suggests that there is some, at least low-level community spread that they haven't fully detected. There was a remarkable speech from the Prime Minister on Sunday night where he basically acknowledged that they may have to just allow this to burn its way through the population, that they might not be able to contain it. Now, they're not at the point of declaring that yet, but clearly they're thinking that they might not be able to contain this.